I'm Kelly Erb. I'm the Policy Program Coordinator here at the Rural Health Center. This session is a recording of a session that I did at the forum this year. And basically it goes over the legislative process, how a bill becomes a law, talks about how that process works here in Colorado. Then we get into policy and the protocol here at the Rural Health Center and what we do. And then finally, we're going to talk about grassroots organizing, exactly what that is and how you all can get involved and advocate for causes that are great for rural health. So I hope you enjoy, and I look forward to meeting some of you. Take care.
Okay, so welcome everyone. Just because it's a small session doesn't mean it won't be awesome. I'm really excited to be able to talk about this stuff anyway, and to let folks know more about what's going on with our policy program. So this is Grassroots Advocacy, engaging with the legislative process. I'm Kelly Erb, the Policy Program Coordinator at the Rural Health Center. So today, what we're going to do is, first we're going to go through just a quick legislative 101. How does a bill become a law here in Colorado? What does the Colorado General Assembly look like? What are politics looking like in this session? We're going to talk about policy and advocacy at the Rural Health Center. What are we doing involved with policy? What does that have to do with healthcare? And again, what kind of services or resources can we offer to our members? We're going to talk about grassroots organizing, which is always a really fun phrase and always seems really empowering and exciting, but that's pretty general. And so we're going to define that and talk about some methods of which to do so. We're going to take a short break, and then we're going to do an activity where we're going to be able to organize and take some of these new skills and try them out. Then we will share all of our awesome ideas and wrap things up, and I'll be able to address any questions. So first, politics can seem intimidating. Just like the session you saw playing, or you see C-SPAN, or you see Uncle Sam pointing at you, or you read about all of these things, and it can seem very unapproachable. It's a lot of old guys in suits and terms that we don't really understand. But they really don't have to be, because this is dorky. Because elected officials work for you. You vote them in. They only have their jobs because of your say-so, and you're the person who is in charge. Their job is to literally represent you. That's what representative government does. And so I think that folks often need to remind themselves that our state senators, our representatives really do come from our neighborhoods, from our regions, and represent us as their job. So you are the expert on your experience. This is the other part that is so crucial to know. Because politics can seem intimidating, or like we don't have the answers or know what's going on. Yes, you do. When we talk about workforce in these rural areas, you're the expert on that. Or you're the expert on how you experience it, whether you're the front desk lady or you are an emergency room physician. You are the expert on how these policies are affecting your day-to-day activities, your patients, your clinic. So before we get into how we can affect the process, let's learn a little bit about how a bill becomes a law in Colorado. This was developed by the Colorado Channel, who is listed in your resource folder. There's folders up there. They're a great resource because they offer live coverage of all sessions. General Assembly is video, and then all committee hearings, you can hear audio. They're archived for years back. They include the journal, so you can watch any of this online. But yes, the Colorado Channel developed this great video clip.
Have you ever wondered how laws are created in Colorado? Where do ideas for laws originate? How does the process work? Let's start from the beginning and work our way through. And at the end, you'll be a civics pro. It all starts with the Colorado Constitution. Article 3 of the Colorado Constitution designates 3 separate and distinct branches of government: the executive branch, the legislative branch, and the judicial branch. The General Assembly is the entity where bills are written, debated, and voted on to become law. The Colorado General Assembly has 2 chambers: the House of Representatives and the Senate. The House has 65 members and the Senate has 35, for a total of 100 members. The General Assembly is guided by the state constitution to meet 120 consecutive days, beginning no later than the second Wednesday in January. Historically, the General Assembly considers fewer than 1,000 bills, resolutions, and memorials during a legislative session. However, there are other ways to create laws in Colorado other than the General Assembly passing a bill into law. A law can also be created through the initiative process, where citizens circulate and sign petitions to place an issue on the ballot so Colorado voters can directly approve or reject an idea. The General Assembly can also refer a bill to the voters at a general election. If the voters approve, the bill becomes a law. This is called a referendum. But where do bills originate? Where do the ideas that become bills come from? Ideas for laws can come from anywhere. Cities, counties, state agencies, businesses, organizations, special interest groups, and individual citizens. If a legislator is approached with an idea, he or she can decide to sponsor that idea and request a bill be drafted by the Office of Legislative Legal Services. Every bill must have a prime sponsor from each chamber before a draft bill can be created. Once the initial sponsor approves the draft bill, the bill is delivered to either the House or Senate to be introduced. When a bill is introduced, it is assigned a bill number and assigned to a committee for public hearing. The title is read aloud by the reading clerk. This constitutes the first reading of the bill. Committees usually focus on particular issues such as education, transportation, or public health. Each committee must hold a public hearing on every bill assigned to it. When a committee meets, the sponsor will explain the bill. Anyone from the community can attend this meeting to voice their support, express concerns, or suggest changes. However, only committee members may offer an amendment that the committee can act on. A committee can then do several different things. It may recommend the bill with or without amendments. It can postpone the bill indefinitely, essentially killing the bill. It can hold the bill over for another hearing in the same committee, or it can refer the bill to another committee with or without amendments. A committee report is then issued that formalizes the committee's activity. Bills that are favorably recommended are then placed on the calendar for consideration on second reading, with any accompanying committee reports. The second reading of a bill involves the entire chamber forming a committee of the whole, or COW, and there are no time limits on debate. Here, members debate the merits of the bill and may offer amendments. A voice vote is usually all that is required for approval, with the appointed chairperson of the COW determining the fate of the bill. However, a member may request a division vote where members must stand in support or opposition of the bill. If the bill is approved, then the bill and any approved amendments are combined into a new document that is called an engrossed bill. That bill is then placed on the calendar for third reading. Third reading is where the final debate and recorded vote on the bill occurs. If the bill is approved by recorded vote, the engrossed bill and any approved third reading amendments are then combined into a re-engrossed bill. The bill then goes to the other chamber, where the same process starts all over again. When and if the second chamber approves the bill on second reading, it then becomes a revised bill. If the bill makes it all the way through the third reading in the second chamber, it becomes a re-revised bill and is sent back to the first chamber, where any amendments made by the other chamber must be approved. Are you confused yet? If the bill passes through both chambers without any changes, or if the first chamber accepts the changes made by the second chamber, it is sent to the governor for action. If the first chamber rejects any amendments made by the second chamber, the sponsor can ask for a conference committee, which is made up of 3 members from each chamber. These individuals then try to iron out the differences between the 2 chambers and reach an agreement. If they can reach an agreement, then a report that contains the conference committee's suggestions is issued. If both chambers adopt the report, then the bill is sent to the governor for his or her action. The governor then has 3 options once their office receives a bill. The governor can sign the bill into law, he or she can veto the bill, or he or she can let the bill become law without their signature. A bill becomes law without the governor's signature after 10 days if he or she receives the bill during the legislative session, or after 30 days if he or she receives the bill after the General Assembly has adjourned. If the governor vetoes the bill before the General Assembly adjourns, it goes back to the General Assembly for more consideration. If a bill can be approved by 2/3 of the members in each chamber, the veto is overridden and the bill becomes a law. Vetoes occurring after the General Assembly adjourns are final. So that's it. That's how a bill becomes a law in Colorado. There are tools that can help you follow the process. The calendar, journal, and status sheet are ways to track bills and see when debates will occur. All of these documents and more are available online at the General Assembly's website, and additional information is available at the Colorado Channel website. Thanks for watching, and we hope that this program will help you become more informed about making law in Colorado.
So I do think that gets a little tricky towards the end, but it is definitely a very thorough means of expressing how a bill becomes a law here in this state. Luckily, there aren't usually, well, that's not true. The process is just generally more simple than, typically if a bill is going to have to go through so many chambers, it'll usually be killed or postponed indefinitely before it keeps going back and forth. Or if the governor is going to veto it, you usually have a pretty good feeling early on for how there are a lot of surprises in politics, but you can generally forecast how people are going to vote or what's going to happen to a bill, which is great. There we go. So we will just quickly review the process of how a bill becomes Colorado law. This sheet is listed in your resource folder. It's a great sheet, and I always laugh at the funny clip art job that somebody really just unloaded on this thing. So how a bill becomes Colorado law. First, the bill is introduced either in the House or the Senate and is read aloud. It is then the chair of the committee, the General Assembly president, so it's the president of the Senate or the Speaker of the House in the House of Representatives, who then assigns it to the appropriate committee. There are 2 health committees in the House of Representatives, and there's only 1 health committee in the Senate, though sometimes I'm surprised at where bills are directed to. Sometimes they'll send something off to appropriations that's seemingly a health bill, but it has to do with money. So again, the Speaker of the House or the Senate president decides where those committees or where a bill is assigned. It is in that committee where a public hearing and testimony happens. This is the exciting part and the part where you folks can all get involved. These are completely open to the public. As long as you follow protocol, you can get up there and say whatever you want. Hopefully it has some relevancy to a bill. We're going to talk a little bit more about testimony later in the presentation, but we have testified this year on Senate Bill 197 at the Rural Health Center. Some of our staff did, as did some of our members, and again, I think it was really effective in presenting a rural perspective, both objectively with some great HARC data and some CPR data that we used, as well as personal stories from our members. So if a bill passes committee, it's voted in committee. All you need is a majority. If it passes in committee, then it moves to the floor for a vote, which is right now where Senate Bill 197 is. You have to vote twice in Colorado on the floor. Generally, there isn't too much debate that's introduced on a floor vote because it's considered, the committees are very specific and folks who are on those committees sit on them for a reason. On the Senate Health Committee is Senator Aguilar, who's a Democrat, who's a former physician. Conversely, on the House of Representatives, Representative Joshi is a former internist, who you know, Denise, right? Yeah, so again, these people usually have some specific skill sets or there's a reason that they're on these committees. So if it passes, especially unanimously in committee, generally the General Assembly will bless the bill and it will go through. So then the process begins completely on the other side or the other chamber. So the bill is introduced, assigned to committee, goes to committee. At the committee hearing, it's voted on. If it's approved, then it heads back down for its 2 votes. Let's say a bill is introduced in the House, passes completely, gets introduced at the Senate, but the Senate committee makes some amendments. Those amendments have to be okayed and go back to the House before the bill can then go to the governor for approval. So all of that has to be ironed out, and sometimes bills can just be volleyed back and forth until things are ironed out. It's then at this point that the governor can either sign or veto the bill. You did see in that video clip that a bill can become law if the governor doesn't sign it. This is usually done as a gesture by him or her because, again, those bills will become law within 10 days within session if he doesn't sign it, him or her, and within 30 days outside of session. And again, that's just a gesture for the governor to say, yes, perhaps our General Assembly thinks that this bill should become a law, but I don't, but the people have spoken. Otherwise, it can be vetoed, and that veto can be overridden by a 2/3 majority. So here's just a sample of what a bill looks like. This is Senate Bill 197. So I'll kind of walk you through how this all breaks down, but all bills look the exact same in formatting, which is helpful. You've got which session we're in. So we're in the first regular session of the 70th General Assembly in the state. Let's see, the bill is assigned a number. So how it works with these numbers is Senate Bill 197 is called SB 197 because it's a Senate bill. The 15 comes after it because we're in 2015. And then all Senate bills start at number 0 through 999. And then all House bills start at 1001 and go to 2000. So Senate Bill 197, and then you'll have House Bill 1015. So that's kind of an easy way to keep those in order. You've got your Senate and House sponsor. As we said, you need a Senate and House sponsor for a bill to be introduced. And then you'll have the committees listed, the bill title, which can usually be in itself a political thing. Just this year we had a bill introduced called the Parents' Bill of Rights, which was it was a politically charged name because the bill necessarily allowed parents to override certain state regulations, certain school regulations like immunization or the teaching of sex ed. So a lot of people, generally when you think, well, we support a parent's right, because that was such a well-chosen name, but if you looked into the bill a little bit further, it maybe had some different implications for maybe children who had neglectful parents, or, are they being immunized, or all sorts of things. So again, the choosing of the title of a bill is very political and very decisive, I think. The bill summary is very interesting, and again, if you don't want to read through the whole bill, this is a great way to just kind of digest what exactly they mean. And then we get into the body of the bill. Each line is numbered because, let's say in committee, or they'd like to make an amendment, they'll say on page 2, line 14, I'd like to strike this language. So anything in caps is new language. Anything in just regular typecase is what a bill currently looks like. Anything with a strike through is removed language. Anything that is shaded in gray connotates a House amendment, and anything that is double underlined, I don't think we have anything in here, is a Senate amendment. So it's just kind of like a weird puzzle or symbols or things. They can be tricky to read. Some of them are, and some of them are very straightforward. I looked at a bill this year, which basically wasn't even a bill. It was just changing the way that we look at minimum wage in the state, saying that it could be that a local jurisdiction could decide on their minimum wage rate. And what it did is that it amended a state law that said only states can make that law. So basically all the bill looked like was just strike-through language because it was basically saying that bill was null and void. It did not pass, but yeah, there's all sorts of different ways that these things look like. So now we're going to talk about the Colorado General Assembly. So our General Assembly has a House of 65 members and a Senate of 35, which equals 100. Term limits. So in the House, you can serve up to two-year terms up to 4 times, so that's 8 years. And then on the flip side, in the Senate, you can have a 4-year term up to 2 times, so that's 8 years again. I will say that compared to other states, these are relatively short term limits. And states themselves decide on term limits, or if they'd like them at all. Some states don't have any. And I do think that this is kind of reflective of the more conservative spirit of Colorado, and that we would like our politicians to be real people and not seasoned or career politicians. But on the other side of that, you can also come into hiccups of people who don't really know what they're doing or how procedures work or all of that. So I do think that there are some merits to term limits or not. And then, of course, the question that I'm always wondering is how much are these people actually making? How much are you getting paid to have your entire life drug out. You've got to campaign for probably a year and then sit in all of these sessions and necessarily deal with some ridicule or deal with becoming a political superstar. So how much are you getting paid? $30,000 a year annually. Each state, again, decides on what their legislatures make. I think California has the highest, and they are paid it's under $200,000, but over $150,000 annually. And then there's also a session per diem rate. So there's 120 days of session each year. And we pay in Colorado $183 a day for members who live more than 50 miles from the Capitol. So that's any of our rural representatives. And then $45 a day for members who live 50 or few miles from the Capitol. So I was personally surprised at thinking that this was on the lower end. I know that there are plenty of folks, especially who work in some of our rural clinics, who don't make much more than this. But I was pleasantly surprised at the lower rate that these were paid. And I think that, again, is in the same sense reflective of how Colorado feels in having these more strict term limits and not paying you a ton of money. Just kind of the spirit of Colorado. So now we're going to talk about what's going on this year in the General Assembly. So we have a Republican-controlled Senate, and my apologies here, we have 18 Republicans and 17 Democrats. And whenever I think, wow, we have 100 politicians in this General Assembly, that seems like so many politicians. Do we really need all these people? The breakdown is always interesting. Each senator currently represents 143,000 Coloradans, which is, I think, that's huge. So when you think that maybe there are a few too many people in there, that's a lot of folks for just one person to be representing. Then we have a Democratic-controlled House. So there are 37 Democrats and 28 Republicans, and each representative represents 77,000 Coloradans. We're currently in session. The session began on January 7th of this year. It's scheduled to adjourn on May 6th. I learned something new about Colorado politics, in that there is a deadline that was Monday for all bills to be introduced. Senate bills were to be introduced by Monday, and House bills were due to be in late last week. When I went on Monday to look at all of my flood of new bills, there were none. So I called the Capitol to figure out what was going on. I imagine there had to be a few things introduced. And they let me know that here in Colorado, the deadlines for bills are the deadlines that are listed in the calendar are more guidelines. So considering those 3 votes needed to make a bill into a law, your committee vote and your 2 floor votes, technically in this state, you can introduce a bill up to 3 days before the session ends. So that's interesting for me, at least coming from a state where that's not the case. But again, it just goes to show that each state kind of runs its own show. I will say, though, that the session is scheduled to adjourn on May 6th, and you cannot exceed that 120-day time limit without special permission from the governor. It's then considered a special session. This especially is frowned upon all over the country, but especially here in Colorado, where, again, we think that you should be able to iron these things out in 120 days, get this stuff figured out. We don't want to be spending all this extra money. You've got to pay per diem and the janitor and all of those other people who are at the Capitol. So it's a big chunk of change, and it's a pretty gutsy move. If you'd like to extend it, I believe in 2009 there was a special session, and now that I think of it, that probably was in conjunction with the passage of Tabor. So what do we do with policy here at the Rural Health Center? So the core components of our policy and advocacy program are as follows. We review bills and proposed regulations at the state and federal level. We take positions on bills and proposed regulation based on feedback from our PLC, from our staff, and board approval. We monitor policy trends at the state and federal level. So we try to keep ahead of trends or kind of figure out what's coming down the chute. When we're not in session, that's when a lot of groups are getting together and saying we should take this on next session, or people are coming up or drafting bills or looking for sponsors. So try to keep our head in what's going on that front. Establish relationships with policymakers. This is really important to try to establish these relationships outside of the session, because nobody likes to have somebody come up and introduce them and be wanting a relationship when you're in session. You need to create that relationship before you want something from someone. It's definitely the better way to start it, to just say, hey, I worked at the Rural Health Center. We want to make sure that you're considering the rural perspective when you're passing votes next session. And I don't have anything specifically to ask you, but I just wanted to introduce myself and make myself a resource for you, and hopefully we can work together next session. So trying to create those relationships before you ask for something, I think is key to being effective with your leaders, because then it's a real relationship. And then communicate policy information to the broadest audience possible. So doing things like this, or making sure that our members are updated about what policies are going through and how it might affect their members or patients or folks in their community. And then we serve as a conduit of information between rural Colorado, Denver, and DC. So you all aren't able to speak to your representatives every day or to convey your perspective. And that's why the Rural Health Center is such a resource with our data, with our relationships, to be able to serve as a liaison between all of these different entities to make sure that policy, when it's passed, whether it's in Denver or all the way in DC, that they're considering folks out in rural Colorado who are doing the real work, who are the experts, and who put these people into that position in the first place. So every time that I am looking through new bills that are introduced during the session, and it can vary from no bills being introduced on Monday to sometimes I'll probably usually have 6 or 7 introduced most days, but at the beginning of the session, like 30 bills introduced a day. And so how do you decide what's relevant? And I think the challenge for my position is that we all know that healthcare is so broad. Healthcare is a system. It affects, the economy. It affects workforce. It affects education. It affects the environment. So how do you select what has relevancy? So when I look at bills, I try to always come back to mission, which is enhancing healthcare services by providing information, education, linkages, tools, and energy towards addressing rural healthcare issues. And then I ask myself, basically, how is this bill going to affect our members? And how does this issue relate to our mission? I often, I personally have trouble with deciding if education bills have much relevancy to talk to our members about, because let's say there's specialized rural funding for making sure that there's workforce development, so that kids in rural areas can maybe be looking into specialized community college stuff, or they have specialized programs for let's say welding classes and all of that. They'll have like industry-based things, and they're trying to fund all sorts of little cottage industries or do grants to make sure that kids can be prepared for this. Does that relate to our mission? Necessarily. Maybe we're trying to create a workforce out there in rural Colorado. We want to make sure people stay. So that's always tough, and that's why we have the PLC, and again, my job is very collaborative in that I just try to coordinate these resources and we decide what matters. But when I look at bills every day, I go back to these 2 questions. How does this bill affect our members? How does this issue relate to our mission? So after all of that has come through and I have tracked and selected a few bills for consideration, what I do is I sit down and I analyze those new bills. I read through the whole thing. I use the Colorado Capitol Watch. So any information about bills, whether who's lobbying them, who supports them, full text of them, what committees they're in, even the status of it. This is all available publicly, but this program is really slick, and you can actually access it. The resources listed for you there in your folder, but you can access this website. You just can't create profiles, which it's fine. But this aggregates all of that information into one easy spreadsheet for me. Every day I can come in and see what bills are on the calendar. So as you can see, it's got the bill number, the title. They create their own shorter summary. I've got a full text, House sponsors, Senate sponsors, when things have been introduced. I also use fiscal notes. Fiscal notes, almost all bills are accompanied by fiscal notes. A committee can request them, and that's basically saying, what is this going to cost us? So what are the potential state revenues, and what are the possible state expenditures? They also break down what that might mean in terms of workforce for the state. They also include some background. So that's often a make or break moment for a bill. So if you've got some grandiose idea, you really have to come to them with, they really are specific about what dollar amounts could mean or what this could mean for the state in terms of do we have capacity to do this. So fiscal notes are a great resource. The Secretary of State's website. Legally in Colorado, all lobbyists are required to register with the state. So I'm registered with the state, and then every month I file disclosure statements about my lobbying activities. So saying any money that I personally am making doing lobbying activities, I have to disclose with the state. Also with that, here in Colorado, you have to disclose what bills you are supporting and opposing, and surprisingly here, also what bills you're monitoring. So they even want to know just what bills you're looking at. And again, I file those each month with the Rural Health Center as my principal, so who I lobby for. I will say that lobbying is a very small part of my position, but something that is necessary. So we do file all those necessary paperwork. So the third thing, so then we select bills with relevancy. Again, go back to mission and all of that, select bills, and then we bring them to our policy and legislative committee. So this committee meets twice a month during session, Fridays at noon. It's a conference call. For rules, there's a minimum of 10 members and a maximum of 30. We're currently at 13, so plenty of room to grow. And what necessarily happens is that I will introduce any new bills, kind of give a brief summary and what I think could potentially be the rural relevancy of it. And then conversations are had, and folks from around the states with different perspectives, whether they're doctors, nurses, the administrative front desk lady, or a dentist. Whoever is on our committee debates that bill and decides to take a position on it. I will say that you can sign up to join the PLC for next year. I think that it's a great way to get involved and to be active in these processes. And again, I don't want to take positions for you all because I don't work in rural communities. So we need to make sure that we have representation geographically and across sectors in terms of making sure that we have administrative folks and doctors, nurses, all of that, having these conversations, because this is what we're using your membership money, this is what we do for you all. So let's make sure that we're being represented there. So then the PLC decides on the position of a bill. So they can either decide to support it, oppose it, monitor it, or maybe they just need more information, too early to make a call. So based on those decisions, we'll take action. So if we decide to support or oppose a bill, all bills that we have officially supported or opposed, so after the PLC makes a decision, those decisions go to the board for approval. Generally, they okay it. We haven't had any issues with that. So if we decide to support or oppose a bill, we'll develop a bill report. All of our bills that have been supported or opposed have a bill report. It's just a one-page document that's pretty simple. It includes, dates that the bill was introduced, who is the Senate or House sponsor, what committee it's in. These are all available on our website, but the most important part is that it includes a summary, and then the second section includes what we call the rural impact. Okay, so what does this mean for us? And I think these are a great, just one-page resource for people to kind of get the gist of what is the actual meat of this. And to develop those reports, we use data from HARC, which is another great resource at the Rural Health Center. We may use recruitment data from Ashley at CPR. We have got so many resources at the Rural Health Center in terms of data or perspective, so we really try to paint as good of a picture as we can to see what is the rural impact of this bill. And again, those are all available on our website. So then if we decide that we'd like to do more than just inform folks about the rural impact about it, if we'd like to actively support or oppose a bill, then we take action, which is the fun part. So that can start as easily as just writing a letter of support. This is one of the most basic things people do. There is an example of that, and there are two examples in your folder. They're pretty formal letters. You want to make sure that they're kept to one page, very concise. And for me, I think what works effectively, I like to tailor each letter of support to a legislator. I don't think it's a smart idea to just copy off 12 letters and then change the name at the top. So you'll see I like to tweak, at least for Senate Bill 197, I did a letter for rural legislators, specifically calling out the facilities that would be affected by 197. And then if they were an urban legislator, I said, I realize that you represent an urban constituency, but know that we all succeed when we all succeed, and that by supporting this, necessarily it's less pressure on your services, or, you can take all sorts of ways. But to make that specific for them, to know that you're not just running off a letter is effective. And actually mailing it. People don't do that enough. Mailing the letter is effective. Testimony. This is a very exciting, easy way to get involved. Well, easy is tough to say. It's a fun way to get involved, we'll say that. Testimony happens at those committee hearings. You get about 3 to 5 minutes to necessarily go up there and within protocol and procedure, plead your case. And this is, I think, the most effective way to face-to-face interact with your elected officials and to say, I came all this way, scheduled my visit, and here I am, listen up. So Denise, I know that you spoke on Senate Bill 197. Would you mind just making a few comments about how that went for you, or kind of what the experience was like?
Well, it was my first time speaking in front of anyone in the legislature, so it was a little bit nerve-wracking to begin with until we sat there it started at 1:30, and we finally got around. I think our testimony was at 4 o'clock. So by that time, I was feeling really comfortable. But also, I don't know how many people spoke. It felt like 50 people. But by the time they got down to us, the chairwoman just said, "Could you please kind of keep your talk and talk about things that haven't already been spoken about?" Well, Kelly and I both just kind of looked at each other and was like, start scratching. So what's left for us to tell, except how it really impacted us at the rural level, what it meant to me, the lives that we try to cover down there. So I enjoyed it. I guess it's like you do your first time, and after that you just feel like, now you're a pro.
Good.
Yeah.
No, you did such a great job, and actually such a great job that afterwards you saw Representative Joshi left committee to come out and thank you and Kelly for coming all that way to give the perspective. So I know we had to sit around, but I know that it was well received and appreciated. And all the more reason why your personal story is your expert testimony. The stuff we didn't have to scratch out was stuff that was you personally, because nobody can argue with your perspective. You are the expert on your experience and how Senate Bill 197 necessarily would affect the work that you do in your community. So I think that that's often something that people need to remind themselves, because it can seem intimidating, like, what do I know about this? Well, you know it plenty. You're the expert. The other tip I will give about testimony is that it might seem daunting to speak for 3 to 5 minutes, but when you actually type out testimony or anything that you might be speaking, 1 page double-spaced takes about 2 minutes to speak. So you get into just under 2 pages double-spaced, which really isn't that much writing, and you've got about 3 minutes covered right there. So once you kind of figure that out, and again, you saw them pressuring folks to stay concise, don't repeat things, just keeping things as tight and concise and compelling as you can is really the key with all of that.
I thought 3 minutes really went by fast. I mean, even when we lined out,
Mm-hmm.
because Kelly and I both took things out of our comments, it just flies by. So it's not as long as you think.
It goes by pretty quick. And my strategy, I will say honestly, next time is so one of the strategies in testimony is to befriend the staff person who's there, because each committee has a staff person. That's how I got them to get all of our materials distributed. I'm going to say that we have rural members who traveled a long way, and so they need to speak first. So for next time, just know I'm on this. So op-eds, this is another great way to take action on things. I'm going to talk more about these when we get to grassroots advocacy, but again, these are in newspapers, so whether it be a letter to the editor or a guest columnist or whatever, rural newspapers run a lot of things. They run almost anything that's sent to them, and it's free. So this is a really great way to get involved. Meetings with officials. You can just set up a meeting. During session is sometimes tricky because they are so busy. They're constantly in meetings, but all of these representatives have staff people who are, like nice 20-something-year-old kids, and all you have to do is let them know that they will set up a meeting for you. It's easier than you might think, but it's not always easy to get down here to Denver, but there are certainly, this is a great option. So if we decide to monitor a bill, that means that we decided not to take any position, at least yet. We're just going to keep an eye on it. Maybe it's something that's overly political or maybe out of our relevancy. Again, we just track that policy, we keep members updated, and maybe we'll take a position later. I think right now we are monitoring probably 35 bills and supporting under 20. So we monitor quite a few bills. And then bills that we just need more information about. Again, sometimes they're going to say, well, what is it? What is this going to cost us? Or who's supporting this? And then I'll just wait until a fiscal note gets released, or I'll call a bill sponsor and say, what were you thinking? Or I will go to the Secretary of State website and see who's lobbying all of this. Or the Denver Post does a great job of covering what's going on in the General Assembly. They have reporters there constantly. And they're often getting great little news clips and sound bites from representatives and legislators so that you can kind of understand more of a contextual explanation of what's going on behind a bill. Okay, so that's necessarily what we do with bills at the Rural Health Center. So we will try to take action on what we can while we're in session, and then when we're outside of session, we try to create relationships with our members and with legislators so that we can really know. We want to get your perspective as much as we can, and then we want to take that perspective and bring it to Denver, bring it to DC, and make sure that those relationships are established before we're asking for something. So now that you're all excited about the work that happens at the Rural Health Center with policy, how can you get involved? You can join the PLC next year. There's a sign up right near the door, and again, join in our calls, noon on Fridays for an hour. I send an agenda, try to make it as easy as we can to get people understanding what's going on, and it's a great way to get involved. And again, all I want is to hear feedback from all of you so that I can keep doing some work. Also, if the PLC is too much work for you, or you don't work Fridays or what have you, you can just sign up next to the door just to get policy updates. I think that it's a good idea for us to kind of establish during session kind of some updates, or you can just get the updates that I send the PLC. I keep everything tracked in a huge Excel spreadsheet that's color-coded based on bills that we're supporting, monitoring, or opposing. And I send that usually twice a week with updates for bills. So, and then yes, here's just members who'd like to just get more involved with the policy program, or have questions, or want me to help you with an issue in your community. So now we're going to talk about grassroots organizing and advocacy, which again is always a fun catchphrase or buzzword that gets people excited because it can be positive or negative. We hear great things like the Harvey Milk movie that some of us have seen, which is always exciting and uplifting, or you hear about some of the violent rallies that are going on in Ferguson. Those are all things that are considered grassroots advocacy that happen all over the country. And again, they can be positive, negative. There are all sorts of methods to do it, which is why it's hard to define what it is. But this is the definition that I like the best. So grassroots advocacy is the general promotion of an idea, proposal, or cause through education, outreach, and grassroots organization. So people coming together around an issue, and it doesn't have to be a rally or a fight, or we don't have to be proposing a bill. It can just be, we know that there's something going on. Should we be educating people? Should we do some outreach? Should we just organize each other? So advocacy, yes, is a means by which we can move our concerns to create change. So people can come together as those experts in their community and really harness all of those resources and decide to take action, or just to educate one another, or just to have conversations about it. And so advocacy then may include lobbying. We'll get specifically into that. So what is lobbying versus advocacy? Lobbying is a specific request on a specific measure that's targeted to a specific influential audience. So me saying, Senator Ashley, I want you to vote yes on Senate Bill 197. That is lobbying. And there are a lot of legal restrictions for nonprofits when it comes to lobbying, which I'm sure that we can all understand and respect. We are tax exempt, and so you want to make sure that these tax exempt institutions aren't being used to sway public policy in a way that isn't good. So what is said is that nonprofits can't have lobbying be a substantial portion of what they do. Now, what does substantial mean? The IRS defines that through a form, and again, through my disclosure statements each month that I go through the state, they then use that to translate that money that I make, my income, and full disclosure, I report that I lobby 4 hours a month, so not as much, and there are definitely other employees at the Rural Health Center, so 4 hours a month for one employee is not a substantial, it's not a substantial use of our funds that we do for lobbying. But yes, we still are required to report that. Advocacy, on the other hand, is just general support of a broad issue. Senator Ashley, I want you to support workforce and rural Colorado when you're making decisions in committee. Just general support of a general idea you can do all day. You can do that all day. There are no legal restrictions for me in my position or me personally as just a citizen, as Kelly Erb. You can do that all day, and there are absolutely no restrictions based on all sorts of things, freedom of speech. So this especially is something that folks need to take advantage of and know that there are no restrictions on advocacy. Stand up and say whatever you want. So methods of organizing and advocacy. How can you do this? There are tons of methods, but here's what I think are some of the most effective means. Letters of support, again, that's usually your first one. You just want to get out there with a letter and say, I'm going to necessarily start a campaign or some outreach on this. Here's what's going on. You want to direct that to the most powerful person that you can. Op-eds and letters to the editor. I can't say this enough. This is one of the best means of free outreach. And free is the best F word when it comes to grassroots organizing because it's all volunteer run. You know, you don't have any funding. And rural newspapers will run almost anything. They really will. So if you write an op-ed to your small community newspaper that calls out a representative or said this is an issue, that'll get run. And it's a great free means of raising some awareness and starting a conversation in a public forum about an issue. So I cannot stress the importance of this one enough. Testimony in public hearings. So again, going to the Capitol or going to city council meetings or PTA meetings or any of that. Get up there. Again, this is free. Maybe not getting to Denver isn't free, but you know, you can go to your community meetings. These are all free means of you being able to say how you feel and advocate for a cause. This is another huge one. Events and community meetings, Rotary clubs. One of my favorite ones is where do we see people getting together once a week for at least an hour? Church. There's no other gathering of people that is quite as effective as church. And that is one great platform for people who maybe there is some kind of faith-based implication on a bill, or maybe not, or maybe it's just a great way to get people who have similar values in a room together. Go to these meetings. They're free. Stand up. Social media. This one I'm a little hazy about because as we all know with social media, sometimes it can feel like you're doing something without actually doing something. So let's say you started a Facebook page, but when people click like, sometimes they think that they're doing something. So I think the method by which social media is used in advocacy and organizing is really important because then you look at things like the ALS Ice Bucket Challenge. Whoa, right? I mean, that blew up and turned the advocacy world on their head. They're like, whoa. We kind of thought that Facebook was just kind of a thing that we had to do because everyone has a Facebook. And then all of this money poured in. And I mean, the Ice Bucket Challenge was the cool, hip thing for a long time. But even they had issues with how do you have accountability? Lots of people did that challenge and didn't donate. So I think that social media is something that is necessary in this day and age, but it needs to be used wisely, and some sense of accountability is certainly needs to come into play with that. Art and music. This is great. You know, we have all sorts of, whether it be a mural or gorgeous art that's painted or people who create, we all remember Obama's Change poster. So art is certainly an effective means of creating social change. Music, you've got everything from rap musicians talking about police and all of that to folk musicians talking about fracking. So social change certainly happens through these two venues, and I don't think that they get enough credit. Can anyone think of any examples of advocacy in your communities that have been creative or interesting or seen any organizing going on around any issues? No, I'm not super.
So it's people like in your community can start a meetup group based on any kind of topic, like anything like cooking. I've seen cooking groups. Haven't seen a lot of political groups, but like if you want to learn a second language, they have these immersion groups where everyone meets at a coffee shop and talks Spanish for 2 hours, or you can really create a meetup group for anything and just do it online. I guess it'd be interesting to see how many of those are politically driven.
I did see something similar to that I just read an article about. It was a group in Denver who was a knitting group that would get together and knit hats and socks and all of this. And they realized, they're like, we are cranking out a ton of these things. What should we do with them? So what the group decided to do was expand, meet together, and then at every meeting afterwards, with all the materials that they had knitted and produced, they went around and tied these scarves to trees with little notes that just said, take it if you need one. If you're a homeless person, or if you're a mom who forgot your kid's scarf. They were just going around Denver and necessarily tagging trees and poles with hand knitted scarves and hats. That is advocacy, and so cool, and a great way that people can harness things that they're already interested in, whether it's just knitting or if you're an advocate of homelessness. It's just incredible what people can do when they come together, and it doesn't necessarily have to be political. Just when people kind of find values and feel like, even for you, Denise, like, I think once you feel like you can make a step, or once you feel like you have the means by which to move or advocate, it's empowering, and it's exciting to get other people involved. And then you kind of snowball in. You're like, oh, I could take that on. Well, let's take this on. So it's an exciting thing, and all the more reason why I think once people kind of understand the process, realize that you're an expert and that this whole process is based on you, just jump in. So again, why should you advocate? Because you are the expert. Our elected officials, they work for us. The work that you all are doing is so important in your communities, and we need to make sure that we are sharing that with these people whose decisions affect the work that we do. They affect our families, our communities, and our state. So again, it's just as simple as a phone call or an email or a letter is all that it really takes to start the ball rolling. But if you don't have the time, or if you don't want to, or you're intimidated or whatever, that's what we're here for. We are a resource for you all to be able to do this. The policy program doesn't exist unless you all need some help, and we have issues that we can move on and work on. So again, tracking bills is one big part of the policy program, but all of that information is available online. What I want to do is help you all advocate and to create change in your communities, and to make sure that the folks who are making decisions that affect you all have your perspective in mind. So help me help you. So again, what do all these different methods of advocacy have in common? Whether it's a painting or you're standing at a PTA meeting, is messaging. We could do a training on messaging, and that would last 2 hours in and of itself, how you do that. But the key components with messaging is to make it concise. So just tighten it up. It needs to be compelling. Whether it's emotionally compelling or uses good data, people need to feel, you need to catalyze someone to move. And then it needs to be consistent. You just need to keep saying the same thing. Once you've developed your messaging, through all sorts of means, whether it's an op-ed, whether you're writing a song, or whether you're going to testify. All of that needs to come from the same language, the same line of feeling, just making sure that those things are kept in. And even, when we were writing our testimony, concise, just keeping it tight and neat, because folks really don't make their decisions based on logic, which sounds terrible to say, but in this day and age, when you can like something on Facebook and feel like you're making a difference, or if you watch a 30-second ad on TV and think, oh, that's how I'm going to make my vote, that's how things are decided these days. So politics now is just about messaging, keeping it as concise and compelling and consistent as we can. Another important thing to consider, which our speaker went over yesterday and did such an amazing job yesterday afternoon, is the power of story. So I'll tell you guys a little story, or how this kind of struck me when I started at the Rural Health Center. So right when I started my position, I went around and I met everyone and I did our polite introductions and here's what I do and here's what you do and how they could relate. And I met with Courtney, who's one of our quality improvement specialists. She does quality improvement at our clinics and hospitals and travels around, and she was trying to convey to me the fact that workforce is such an issue in these rural communities and that all of these administrators or doctors or nurses wear a lot of different hats. Now I'm from a rural community and I get it. And in my head, I'm like nodding, okay, yeah, I'll consider that. But then she says to me, no, so I've got a story to tell you to convey this. She said she once went into a clinic for a meeting for, some quality improvement thing that she does. And she goes in there and sitting next to the front desk lady is a goat. It's in a pen, in like a kid's playpen. A goat when you go into a rural health clinic. And so she goes in there and she's like, what is this goat doing here? And the front desk lady says to her, well, I know this isn't the most professional thing, but I am the administrator here and I also am a goat farmer and my goat is sick. And I couldn't close down the facility for the day because we have patients that we need to see, but somebody needed to watch my goat. So she brought the goat in with her and had this goat sitting with her next to her desk. And Courtney said that she had a meeting with this goat making goat noises the whole time. And in my head, it painted such a picture and such an episode. And again, you could tell somebody all day that workforce is an issue in rural Colorado, but until you think of entering a clinic and seeing a goat in a kid's playpen next to the front desk, you don't really realize the dire straits that we're talking about. So again, the power of story. We can talk statistics all day, but until Denise says that her APN is going to leave unless her hours are removed, you don't really understand until you share that. And that goes back to, again, you're an expert on your own story. There are no statistics to tell me that goat story, and now it will never leave my head. So this is the activity that is planned. So this just in, this is a news flash. So state budget priorities are threatening the closure of Painted Turtle Hospital, which is in Painted Turtle, Colorado. And so a little bit about Painted Turtle Hospital. It is an 18-bed hospital that employs 200 people. Painted Turtle Hospital is the only hospital in Painted Turtle, Colorado, which has a population of 4,600 people. This is a fictional place, by the way. And so the next nearest hospital is over 50 miles away in Lark Bunting, Colorado. We chose these names because the Painted Turtle is the state reptile and the Lark Bunting is the state bird. I had no idea. So imagine yourself in your current job role at Painted Turtle Hospital. We are going to save this hospital. So we created this small little campaign, raise your hand, raise your voice. And I found this adorable turtle picture raising his hand. Splitting into 3 campaign teams. So the first team is communications. And that team is going to draft an op-ed, a piece of testimony or a letter of support in order to save Painted Turtle. Second team is outreach and events. This team is tasked with drafting a poster or a flyer and also coming up with one awesome campaign event idea. So the group before decided that they knew one of the ladies was great at making burritos, so they were going to host a burrito supper and a fundraiser to get out the word, because apparently people in their community go to these things all the time. And then the third group, volunteer recruitment and coordination. So this group would be tasked with developing a compelling volunteer email blast. I'm sure we've all gotten these in our inbox. Help us out now. Raise your voice. Well, what really works? What's compelling to people? And then to develop a 30-second grocery store pitch to recruit community volunteers. These things are so crucial to rural communities because, when you're going around the grocery store and you run into Carol, and once you're done talking about what vegetables are on sale, you have that conversation of, well, did you hear what's happening at Painted Turtle? How do you make those community interactions that happen every day, how do you catalyze that into being advocacy? How can you say, well, we've got a group getting together in the next couple of days, and I know that you're not super interested in politics, but if you could just come and give your perspective. I know that your sister-in-law works at the clinic, or I know that your son got hurt snowboarding last year and you would have had to go all the way to Lark Bunting. So again, to just draft that 30-second grocery store pitch. We call it the grocery store pitch because in rural communities, well, first of all, no one talks on elevators anyway. So we always like that. Like, who does that? And in a rural community, it's much more likely that you'll run into somebody at the grocery store than on an elevator in order to talk about these kinds of things. So I did develop talking points because that's really the toughest part, I think, of getting a campaign or advocacy rolling is developing that consistent, compelling, concise messaging. So I developed the talking points for Painted Turtle. But yeah, basically saving Painted Turtle Hospital comes down to this, that citizens of Painted Turtle and the surrounding areas depend on Painted Turtle Hospital for the health of themselves, their families, and their communities. The next nearest hospital is over 50 miles away, and Colorado is a rural state with over 70% of the landmass considered rural. So closing this hospital would negatively affect access to care and overall public safety in the entire state. The second talking point, and usually we try to keep it 3 to 5. 3 is the best idea with talking points, just 3 things. The second thing, Painted Turtle Hospital is an economic driver for the community and the whole state. Healthcare is one of the top 3 industries in rural Colorado, and the hospital employs over 200 Painted Turtle community members. That's just the employees. Think of the numbers that includes their families and all of those other folks. There's thousands of people we're talking about then. Employees and hospital visitors put money directly back into the local economy with every paycheck and every hospital visit. So they use those checks in our local grocery stores. Folks who come to stay and visit their family members, whether they buy a Coke in the vending machine or decide to maybe buy some property. We like it around here. Again, that money goes right back into your community. The third talking point, strong rural communities support a strong Colorado. Again, you just want to tie it up right at the end. This is good for the whole state. Closing Painted Turtle Hospital will cost Colorado more in the long run than reprioritizing funds to keep it open presently. Decreased access to care and a loss of local employment will create a greater dependence on state assistance and unemployment services. So then you've got more people on SNAP benefits, you've got people on unemployment, folks who can't start businesses. Again, so these are the talking points that were developed for Saving Painted Turtle. And I think it's important to point out that once you get your messaging down, I like to say to people, you don't have to recreate the wheel. Every time you're like, well, let's do a letter of support. Well, maybe we should write an op-ed or maybe a speech. Everything from your campaign or your advocacy comes from your talking points. It's just reordering, it's just removing, it's adding story to it, it's adding statistics. But again, staying consistent and saying to your 3 points, look, people depend on this place. That's an economic driver, and this whole state's gonna suffer if you close this place down. All needs to come back to that, coming back to messaging and staying consistent, and then everything that you do, whether it's communications, outreach, volunteer recruitment, comes back to what you have decided is your most core components of why this matters. So yeah. Now we can get to work. Again, I'm not sure that we have the number of folks right now that we'd like to do this activity. So I'm willing to answer any questions, or we can further our discussion about advocacy or the policy program at the Rural Health Center. My apologies for not having the numbers that we'd like.